Test yourself on popular dementia and psychosis treatment questions. Mr. Hall is a 75-year-old male brought into the clinic by his wife. He reports that over the past 6 months, he has had good days and bad days, where his alertness and confusion seem to fluctuate significantly. He started seeing fully formed, vivid, colorful visual hallucinations of children playing in his living room, though he has little insight into their nature. Additionally, his wife is often awakened by him swearing and kicking in his sleep. He appears to be acting out his dreams, but has no memory of the events in the morning. On physical exam, he shows mild symmetric rigidity, bradykinesia, and mass facies. What is the most likely diagnosis? A. Alzheimer's disease, B. Frontotemporal dementia, C. Lewy body dementia, or D. Parkinson's dementia. The correct answer is C. Lewy body dementia. You really have to know your dementias for the exam, and Lewy body dementia is classically characterized by fluctuating arousal, vivid visual hallucinations, and Parkinsonian motor features. Alzheimer's typically presents with insidious memory loss first, and frontotemporal dementia often involves early personality changes. Now, they love to trip you up on the difference between Lewy body dementia and Parkinson's dementia, and in Parkinson's dementia, the motor symptoms are going to occur long before the psychiatric symptoms start. The patient's behavior of acting out dreams by kicking and swearing is most consistent with which sleep disorder? A. Sleep terrors, B. REM sleep behavior disorder, C. Periodic limb movement disorder, D. Nightmare disorder. The correct answer is B. REM sleep behavior disorder. REM sleep behavior disorder involves the loss of normal muscle atonia during REM sleep, leading to the patients acting out their dreams. Now, it's very important that you be able to distinguish this from sleep terrors. Sleep terrors occur in stage 3, non-REM sleep, and they involve intense autonomic arousal. The patient's sleep disorder is most frequently associated with the accumulation of which protein? A. Amyloid beta, B. Tau, C. Alpha-synuclein, or D. Huntingtin. The correct answer is C. Alpha-synuclein proteins. REM sleep behavior disorder is strongly associated with synucleinopathies such as Parkinson's disease, Lewy body dementia, and multiple system atrophy. You do need to know that for the exam as well. Mr. Hall's hallucinations become distressing. Which medication is the most appropriate choice to treat his psychosis while minimizing the risk of worsening his motor symptoms? A. Haldol, B. Risperidone, C. Quetiapine, or D. Olanzapine. The correct answer is C. Quetiapine. Patients with Lewy body disease are highly sensitive to antipsychotics, and they can experience severe EPS side effects. Quetiapine has low D2 affinity, and this is why it's often used to treat visual hallucinations in Parkinson's syndromes without significantly worsening that patient's motor function. A way to remember this is quetiapine is quieter on the D2. A cross-covering physician inadvertently gives Mr. Hall a dose of Thorazine. Shortly after, the patient develops sustained upward eye deviation and severe neck stiffness. This reaction is A. Akathisia, B. Tardive dyskinesia, C. Acute dystonic reaction, or D. Neuroleptic malignant syndrome. The correct answer is C. Acute dystonic reaction. An acute dystonic reaction often presents with muscle spasms. An example of this would be the ocular gyrate crisis, where the patient has upward deviation of their eye. Shortly after receiving a D2 antagonist is when you would expect to see an acute dystonic reaction. Akathisia is this restlessness and need to move. Tardive dyskinesia presents with involuntary, repetitive, purposeless movements. A neuroleptic malignant syndrome presents with fever, lip hyperrigidity, and autonomic instability. What is the most appropriate immediate treatment for this patient's ocular gyrate crisis? A. Propranolol, B. Benztropine, C. Bromocriptine, or D. Lorazepam. The correct answer is B. Benztropine. Acute dystonia is treated with anticholinergics like benztropine or antihistamines like diphenhydramine. Propranolol is used for akathisia, and bromocriptine is used for NMS. You need to know the treatments for all of these side effects. Despite various trials, Mr. Hall's symptoms remain refractory, and the team considers clozapine. What is the mandatory monitoring requirement for this medication? A. Monthly EKG, B. Weekly liver function tests, C. Weekly absolute neutrophil count, Or D, yearly chest x-rays? The correct answer is C, weekly absolute neutrophil count. You do need to know clozapine for the exam because they love to test on it. It carries a risk of agranulocytosis, necessitating regular monitoring of the white blood cell count as well as the absolute neutrophil counts. This is typically weekly at the start of the clozapine treatment. A way to remember this is clozapine check the counts. Mr. Hall is found to have a mass on a routine screening, but he refuses a recommended colonoscopy, stating, "The children living in my room told me it's a trap." If he is determined to lack decision-making capacity, what is the most appropriate next step? A, force the procedure under therapeutic privilege. B, perform the procedure once he is sedated for sleep. C, identify a surrogate decision maker. Or D, discharge the patient immediately. The correct answer is C, identify a surrogate decision maker. They are always going to throw in some legal ethical questions in the exams, so you do need to review these. When a patient lacks capacity due to a psychiatric or neurocognitive condition, the clinician should identify a surrogate decision maker, which would be a durable power of attorney or a state-designated guardian, to make the medical decisions based on the patient's known wishes or best interests. If you still struggle with antipsychotic side effects, I recommend you watch the side effect video, subscribe for new videos every week, and good luck on your exam.